little view. I can see people from all over who are here with us, and it's wonderful to be with you. My name is Sarah Jones, and I am the CEO of Parkinson Movement Disorder Alliance, and we're thrilled to bring this to you today. It is a very special program. Three of some of my favorite people who are going to be here to talk with you and have a conversation with you about how we have difficult conversations and don't challenge the trust within the room when you're talking with whether it's a virtual room or whether it's an in-person room when you're talking with your provider. So I will kick that off in just a minute. A couple little housekeeping pieces. One is, for this program, we welcome you to unmute yourself and have a conversation. We have quite a few RSVPs and we'll have more people joining. So I would just ask, if you ask a question, have a thought to share, if we can kind of keep it to a minute or two, that'll help make sure everybody gets to have a conversation with the providers, because we're lucky to have 3 providers with us here today. Another piece, if you're new to us, if you look in that right corner of your screen, you'll see something that says view, and it'll either say speaker or gallery view. So if you want to look at the whole Brady Bunch picture, which is always fun because that's when you get to see a community, even though we are, physically distancing, we can see a community. If you want to see the gallery view, that'll give you the Brady Bunch view. If you do speaker view, that's going to give you a highlight on the person talking. Either way is fine. You can go back and forth for fun. If you can't figure out how to unmute yourself, you can put a question in chat, just like David Cox just did. So hello, David from Sonoma County, California. I will be there for a glass of wine later today. Okay, good. Let's see. So if you can put it in there, and if you have a question that you feel is real sensitive, that you just don't necessarily want to say out loud, feel free to send it to me. I will absolutely share it as well. So I am going to get us started, and we're going to talk about kind of the principles behind the conception of this program. And I'm really excited to introduce you to 3 wonderful providers. We have Mindy Bixby here with us. She's a DO, and she is in Southern California. I was gonna say they're all in Southern California, but that's not true. Salima Brillman is an MD, and she's actually in Northern California. And then back to Southern California, we have Sherrie Gould, who's a nurse practitioner. All 3 are experts in movement disorders. And I think one of the pieces that make them very special and will make this conversation very special is that they really attend to the whole system. You hear us talking about the ecosystems. You've been getting our emails about focusing on and diving into the ecosystems. And we really believe that, and if you don't know what I'm talking about, it looks like this, and it's on our website, and I'll show it to you at the end. But it focuses on, not just the person with the movement disorder, but the care partners and people that love them, because we know this is a team sport. And, all 3 of these wonderful women really focus on that and care for that. So a good part of today, we're going to focus on what the care partner needs as well, because if the care partner is stronger, then the whole family system is stronger too. So with that, I'm going to turn it over to you guys to kind of just share a little bit about yourselves and also the concept behind this.
Sherrie, you want to start?
Sure. For some reason, Mindy would just jump right in there.
Usually I do, but I was muted. Can I start? I'm Mindy Bixby, and like we all talked about, we are movement disorder specialists, and we love what we do. So that's why we're here today. I feel this Hear Me is a very important concept, because I think everybody deserves a voice. Whether you are the patient or you're the person that's taking care of the person that has Parkinson's, you all need to know that you have a voice so we can move forward in the most beautiful way. And so we thought that Hear Me would be the best way to do this in this type of format, where we have an opportunity to just open yourself up and talk and see what things are going on in your life, and perhaps everybody else is having the same questions or concerns, or ultimately just some comments, and we want you to be heard. And so that's why we're here. Want to take it away?
And I just want to mention as well is that, we really want this a series. We are going to be back with you guys, hopefully even new friends, new faces, every 6 weeks. And this is just an open forum. We are here because we're passionate about Parkinson's in the hugest way. We're passionate about helping our patients, helping families with Parkinson's. So, difficult conversations that maybe you just don't exactly know how to approach them when you go in and you see your provider. How do you bring up certain things about possibly driving or sexual relations or cognitive difficulties or whatever it may be? We're here to try to give you guys some answers and some tools that you can use when you are working with your own team in terms of moving forward with Parkinson's. So our huge goal is, education and support, especially in this time during COVID. It's so hard for everybody not actually being together and being able to hug and touch each other's knee and, really show that kind of physical support. But we're really hoping that through our word and through our knowledge and support verbally, that we can give you a little bit of that so you're feeling, a part of this community.
And I'm Salima Brillman, and I echo what Mindy and Sherrie say as well, and also want to remind you, as you all know, that Parkinson's affects the entire family, and not to forget that you need to take care of yourselves, ask the questions, be your own advocates, and know that you're not alone. We're here to answer questions. And it's super important to take care of yourself so that you can be there for your loved ones as well. And so we hope to provide some relief and answers for you, and education, and an ear for any questions that you may need or have that you might not be able to get elsewhere. So we hope that you enjoy the series.
Oh, were you going to say something, Mindy? No. Okay. I was curious. I'm just going to kick us off, if that's okay, with a topic that has come to us pretty repeatedly, and it's not an unusual topic. It's not new, but I feel like it has created. There's a different level of pain and challenge with it, with COVID, as you referenced. Sherrie, you can't just touch somebody's knee, and you can't be as close to them. And I feel like one of the things that I have heard from care partners is I just see there's some cognitive challenges, and it's the processing, it's the problem solving and some of that stuff that people are seeing. And I think the question is, how does one have a conversation about that? Because it's sensitive. You don't want somebody to feel bad. And yet it's also something that I think is important to talk about.
Well, I think that, we all practice in different places, but just having conversations with our colleagues, even across the United States, I think we're all sort of seeing that in our patients, that this is happening as a result of COVID. COVID is not just one thing that's affecting one system. It's having a global impact on lots of different systems. And I think the fact that we're not having that interaction with people, that we're not going to restaurants, we're not seeing families, we're so secluded, really has an influence on people's cognition. And just people should understand they're not alone. They're not alone in this deterioration of cognition. I think it'll be interesting to see what happens, God willing, when things are opening up a little bit. And I don't know, Sherrie and Mindy, what your take is on that as well.
I think it's a huge, an incredibly huge challenge. And I can't agree with you more that it is incredibly often and frequent that the care partner comes in, even more so than the patient, and just really talks about this difficulty with executive function, organizing things, keeping their checkbook, remembering just small things. I heard from a patient yesterday, a patient's wife yesterday, who, he's just, he doesn't pick up his clothes. He's not shutting the door. He loses his keys all the time. This isn't Alex. He never has done that. And you know, I think all of us in this field are seeing that on a daily basis in our patients. And one of the things that I certainly recommend is exercise. I mean, exercise, as you all know, is kind of the repetitive theme, which it can never be repeated enough. But I really want to bring to everyone's attention the importance of moving the body and really getting that oxygen flowing through the brain. Stagnation is not good for any of us. I mean, I know everyone is trying to, certainly being safe or staying at home. We definitely don't want to get COVID, but it doesn't prevent us from getting outside in open spaces, being careful, wearing a mask, and doing that brisk walk. You would be amazed at how important that is, not only for your physical well-being and for your ability to move and keep your muscles loose and limber, but it's important for your brain. And it's important for neuroplasticity. It's important to make those neurons work and get that dopamine flowing. So I just really want to put a plug, which will be a repetitive theme in our Hear Me series from the three of us, certainly, is that vital importance of getting out and pushing yourself. Everyone can find, or maybe not in Phoenix, there's not a lot of, well, there are some hills in Phoenix, but most of us can find some stairs to go up and down, or going outside. And even if it's flat, it really is a matter of just walking with purpose, not strolling, but walking with big arms and, you know, just big body. And when you do that, that also helps your gut. Not only does it get the blood and the oxygen flowing to your brain, but it also helps many other parts of that are affected by Parkinson's. How about you, Mindy?
Okay, yay, okay. I've been wanting to talk so much, I can't. I'm actually muted just because there's feedback on this line. So please forgive me for the delay at times. I'll do my best to make sure that I'm on the best I can, but I just can't seem to push the button fast enough. So I absolutely mirror what Sherrie says in regard to exercise. I think that's it's difficult for us to get motivated sometimes. This ultimately all of us, no matter what you have, and especially with the COVID and how long it's lasted. And I talked and linked with one of my patients yesterday in regard to understanding that this is something where we don't know when it's going to end. And so if we had an end date in regard to the COVID, it kind of gives you an opportunity to make goals and set things in that regard, and a little bit harder when you don't know when it's going to end. But that said, I think that all of us, if anything, feel like we are in it together, but sometimes we need each other to actually remind us that, hey, you know, I'm having the same symptoms, I'm feeling the same way. And if you have that other person, which is why this is so important of a forum, is to open yourselves up to saying, hey, this is something that's happened to me, because you're going to hear a million people say, yeah, it's happening to me too. I mean, for me, as being in the office, which I am in the office 4 days a week, and I am known as Huggy Bear because that's what I do. And so if I don't have that opportunity to hug you, I'm doing the arm thing to say hello, just because I think it's important to have touch and have verbal feedback for people. And so that's why it's nice to have this opportunity to talk to you, because if anything, all of us are just trying to make it through each day to make sure that we're doing the right things for ourselves and others, but ultimately make sure we're taking care of our body, mind, and spirit. And so that's kind of the goal here, is to make sure that you're doing all that you can possibly do to help yourself, so you feel good and refreshed and rejuvenated, and ultimately have that opportunity to feel like you did a great day for that day. So each day has to start with a brand new day. I know that sounds odd, but if you can have that as, okay, yesterday's gone, we're doing this today, and think about the things that we're talking about promoting right now, ultimately exercise or moving your body, or water, or eating really well, or all the things that we're going to talk about today, you'll know that today it starts today. Today's your day. And then we move forward. And I think that really helps, because you can't look back. We just have to look forward. And that's what we have. And I think that's pretty awesome.
You know, that is so helpful. And I think you're right. It is about being together. Sorry, my cat wants to be with us too. It is about being together, and we have so much wisdom. You know, if you just even check in the chat, there's really great ideas coming up about, you know, exercise, walking outside, walking a half an hour each day, some people climbing mountains, being careful, Nordic pole walking. I mean, I think that there's such wisdom in this room. And I agree. It's wonderful to hear, you know, the doctors talk about the options that happen with being able to have exercise. Somebody sent me a private note and talked about apathy as the real killer. And apathy is hard in the best situation, right? Because apathy is part of Parkinson's, even in a great situation. And you add to it COVID. And this person, when they wrote that, said, we have to figure out how to recognize that moment and deal with it real time. So I'm curious if you guys might want to talk about apathy. It's one of those things that's not fun to talk about, but if we don't, then we could get stuck in it without even knowing it, probably, I'm assuming.
I think it's just so important to know your loved one with Parkinson's, to really understand what Parkinson's is, what's happening in the brain and in the body with these change of multiple neurotransmitters and how that affects one's mood and one's ability to move and one's ability to want to move forward and to shed that apathy. So, an emphasis on, good days, an emphasis on that segment of time. Maybe it's from 10 to 11:30, and that's your good time of day. Guess what? That you as a care partner, that's the time you say, not like, oh, why don't we go for a walk? We can either go for a walk or we can turn on that recorded Zoom rock steady boxing. Which of those two do you want to do? Yeah, you got to capitalize on those good times. Whether you're the person with Parkinson's, it's like, okay, the medicine's working. I've got my on time now. I'm going to grab this opportunity to get there and get moving because you'll feel so much better once you've done that. You'll feel accomplished. You'll pat yourself on the back. You will do that mentally, but even physically, you will reward yourself by just feeling better. So my advice is capture those moments, grab onto them, and that's the time that I really recommend that activity.
Can we define, if you don't mind, if we can define what apathy is and understand kind of the differences between some people that think that they're apathetic or they're depressed? I think it's really important that we actually talk about that, because sometimes when you have Parkinson's, your facial expressions are not as what they used to be. And so a lot of people have verbal, but also have body cues of how somebody's feeling. And it may be completely off of how they're really truly feeling just based on what their body language is showing you. And so the first thing I would like to define is what apathy is. Apathy doesn't necessarily mean that you are depressed. It can mean ultimately that you just don't have as much get up and go that you used to have with things that used to make you excited. It may change. Your life changes in regard to things that you used to love to do. Like I have patients that say, I used to like to play golf and I just don't really care to do it anymore. And those are things where like define you, or that's your signature. Like, oh, I play golf. I root for the Patriots, and I just absolutely love to go eat ice cream. And those things are defining of you. And everybody in the world knows that that's what you are and that's what you like. And that's how it's fun to talk to you and have conversations about that. And that may change because you have changed the way you feel as things that are important. And so you get apathetic about the Patriots. They won kind of idea. And you're like, wait, there's something wrong, because he doesn't feel the same as he does like he used to love the Patriots. I'm just giving you an example. And that may not be the case. I mean, it's not that their mood has changed or they're sad. It's just that they just don't really care as much as they did before. And that's a personality change that the caregiver may feel that it is, or their friends may feel. But it's ultimately just that they're apathetic about it. They're not depressed about it. They're not saddened about it. It's more that that's the change in them. And if we can understand apathy compared to depression, we can actually talk about it a little bit more and have a conversation where it's like, hey, everybody's telling me that I'm depressed, but I'm not. I just don't really feel like doing those things anymore. And maybe you have some new wonderful things you want to do that are different from what you used to like to do. And so apathy is interesting because a lot of times, unfortunately, physicians, care partners, everyone that's taking care of that person because they want them to have the best quality of life and best possible life is they're depressed. Let me give them a medication. Okay, let me make them feel better and give them something antidepressant. And they're like, well, maybe I'm not truly seeing myself and maybe I am a little depressed. And you start to think about it and you come into this pattern of it's actually not that. Apathy can be very much not a sadness or or anything else. It ultimately can come down to just literally just not being as wanting and motivated to do those things that they used to be, and then maybe find new things, which is actually quite exciting. And so apathy is very, very different from depression and mood. It's very different in the brain. The place in the brain is different, why you have it. And when you have lower levels of dopamine, you can have a little bit of apathy. And so ultimately seeing if maybe the dopamine levels are not as high as we would like them to be, and maybe looking at that as a possible treatment. And then also talk about, what is it that talk to you, what is going on in your life? Why do you feel that way anymore? It's like, oh, by the way, I just don't like the Patriots anymore. Again, I keep on bringing up the Patriots for some reason. Why am I saying that kind of thing? Why is that they don't like the ice cream that they used to like? Well, maybe their taste buds have changed, so it may not be that they're like trying to show you that they're sad because they don't like all the lovely things they used to like. It may be other reasons. And that's why we have to dig deep and figure out why.
Definitely. I totally agree with you. And I think it's important for people to tease that out. I always think of apathy as sort of meh, like you just don't, you don't care, whatever. Where you used to, like you said, love with a passion these things. It is different than depression. And I think it's really important that physicians and the people that have it and the care partners try to tease that out as well, so that we can appropriately treat it if possible, and not treat it with things that aren't going to help it, like antidepressants.
One of the things I deal with is I was an attorney, and I went to Ivy League law school and spent a lot of time and energy becoming an attorney. And that's the image that I had. That's what I am. And when I was no longer able to practice law, it changed my whole self-esteem, self-confidence, self-worth, everything. And it would have been nice to get a little bit of a discussion like this beforehand to say, so I could be better prepared for it, because I wasn't prepared for it. It's what I do best, and it's what I can't do anymore. And that's whether that's apathy or depression, I don't know, but it's reality.
I think that you bring up a very, very salient point that I think physicians really need to take into consideration with the person with Parkinson's and the caretaker when a person is about to retire because of Parkinson's. That's a huge decision, and it really can, for most of us, what we do does define us. And to have that sort of void can bring on a depressive syndrome, a situational depression, if you will. So thank you for sharing that. I think it's vitally important to speak to either your physician, a psychologist, somebody about the ramifications. Not that it's not a good decision, but it is something that needs to be talked about and recognized for sure.
And along that line, somebody sent a private note. It sort of fits in the whole retirement piece that you were just talking about, and making the hard decisions. This person sent a note saying that my husband is recently diagnosed. He's still working. There's many uncertainties. Tried to ask the doctor what is realistic to expect for decline rate and symptoms, and he gives upbeat answers like everyone is different. My husband wants to move to an isolated area. He thinks he has 15 to 20 years before he needs help in daily routine. We're trying to look for something realistic. Now, I think, this is something we hear from care partners a lot, and it's okay. I think different people in a relationship have different interests. So it is not unusual for a person with Parkinson's to say, don't tell me everything coming. And I think that kind of makes sense. If you've got depleted dopamine, I don't necessarily know that I want you to deplete it more by telling me some hard things. Some people are not in that space. Care partners generally are like, tell me everything I need to know. So, it really varies, but is there anything along that line in terms of how this progression,
it really is true. And I know that you hear this in every single appointment you go to, but no two people with Parkinson's are the same. So it really is not that we're trying to avoid answering that question with the most hugest honesty we can from our body of knowledge as well as our sensitivity to the subject, but people do progress at different rates. And it's almost impossible. It is impossible to say, well, I think in a year you should probably consider retiring. What I like to tell patients is that instead of looking down the road 20 years, the reason we see you every 4 months minimally is that we work with these issues as they come up, and we want to be on top of it. As this becomes a more pressing issue, or there's more cognitive issues or more difficulty completing your task at work, we're going to revisit this, and we're going to revisit it sooner than 4 months if we need to. I also am a big advocate of getting counseling. I mean, from a professional. I think that they offer, there are huge life changes. I mean, you know, the old expression that Parkinson's isn't you, you know, it's what you have, but it doesn't define you. And it's really important to separate those things and not let Parkinson's define you. And I do believe that working with a professional counselor, a mental health worker, that is any of the life's challenges. You know, for you, it's Parkinson's, but everyone has life challenges. And these people are trained to help you, give you tools and help you walk from step A to step B and give you support in the meantime. And of course, so are your clinicians. I mean, we're here to support you as well, but that more consistent, like every week, you know, you can talk to that mental health counselor, especially one that may be familiar with Parkinson's disease.
I also would like to say a little bit of the devil's advocate of understanding. So I'll give you an example. So I had a patient come see me, wonderful, wonderful couple, that was told by a different doctor that she was going to pass away within 2 years. And she was diagnosed with Parkinsonism. And so they took 2 years to travel all over the world. And they used all their savings to go and enjoy their life in that regard, because they felt that 2 years was the money. That was the time when that person was going to default and go to a different space, to a place where it would be much harder for her to do that. So I saw her at the 2-year mark, and she was doing great. And she had a lot more life in her. And the thing about it was that they used all their savings, and they had really literally nothing to live on at that point, because they wanted to like go for the gusto, which I'm so glad they were able to do that. But on the other hand, playing that role of telling you, oh, you're going to have 2 years and that's it. I mean, imagine that. Imagine somebody having that type of power. It's almost impossible. I don't know what you believe in, whatever you believe in, of where we go and how long we're going to be here, but we cannot be that person. It's impossible. We'll do the best we can with all the knowledge that we have and all the patients we've seen and all the things you're seeing. But even just a day by day moment, we can't tell you where you're going to be in a year, 5 years, 10 years. And if they do tell you that, I think you need to walk away, or at least really think about what they're telling you, that this is what's going to happen to you in a certain amount of time. Yes, of course. I mean, if you have a lot of tremor on one side and it's difficult for you right now to pick up something, it may be more difficult as time goes by, but it may be you need a change in medications, or you need a change in the way your lifestyle is, or you maybe need to work out a little bit more, or maybe you're not sleeping as well, or maybe you're super, super constipated, and we need to help you with that. So you start to have the medication work better. Those are the things we need to do to help you. We can't tell you how long your life is going to be with Parkinson's. It's just impossible, truly.
And I think you bring up a really good point. Somebody sent me a note and said, that's scary, but possible. And I think that's true. And it's a fine line, isn't it? It's a fine line for all of us. I mean, think of how many people, even people without Parkinson's, who say, when I retire, I'm going to take all the trips I never took. And then they retire and then they can't take the trips. So it is a really fine line, I think, with all of us. But one thing that I heard from the three of you, and also came through in a couple different ways in the chats, was that connection with your provider to have the conversation. So there's been a couple comments in here, and one that struck me, David, I want to say I heard you that, you put in here that, managing loss of insight is tough, and it is tough. And you want a provider who you can have that conversation with and who will hear you and see you, and also know even if they can't fix it, they can be with you. And someone else referenced, how do you move from a movement disorder physician or somebody that you've been seeing that isn't a good fit anymore and you need to change to someone else, and or another person put in here that their MDS dismisses concerns about potential side effects and executive function loss. And how do I get my doctor to take me seriously? And I feel like I would love to hear your comments on that, because we hear this from people and, you know, it's almost like cheating on their doctor to go find a doctor that can connect. Thanks. Go ahead, Salima. I'd love to hear your thoughts.
So it's your life, it's your health, and everybody deserves to have a second, third, however many opinions, and find the right fit for you. You're not cheating on anyone. You're not married to your doctor, hopefully. And even if you are, he or she should not be treating you. You deserve, it's your health, it's your life. We all have one life to live. And if you're not getting what you need from your physician, you go find a physician who will give you what you need on every aspect. That's my take on it. I don't think that you should be stuck with anybody. And believe me, if a doctor has enough faith in themselves and cares about you as a person, they will wholeheartedly want you to find someone who fits better with you.
I would absolutely agree. I mean, there's different strokes for different folks kind of idea. And so some people want that, and where somebody takes over their care completely as the doctor, here's my life, fix me. And that's something that's maybe different for somebody else, where they're like, I need to like kind of understand and be educated and understand why you're giving me this medication and what is it supposed to be doing for me, and what are the possible side effects. The best possibilities of understanding of why I would take this bottle is so important. And so if you're not getting that education, because you should walk out of the door from that clinic office having your questions answered and not have more questions when you leave. That's just not the right way. I mean, that's the goal, I hope, for every single physician and care partner and caregiver and provider. But that's not always the case, especially when it comes to Parkinson's, because Parkinson's can be head to toe. There's some things that you may want to address to see if it is part of Parkinson's. And that's why it's so important to be ready for your appointment. And we'll talk about that as well. I know on this stream or a different stream, is to understand that, you know, you are in control of your own life. We can help you kind of move through life the best we possibly can with what we have to offer to help you. But in the end, it's your decision, 100%, whether it be who you choose to be your doctor or what medication you want to take and why you want to take it, and feel comfortable about the safety issues that come with that medication, and move forward.
Yeah, and I have to agree with both of you. I mean, there's a movement disorder doctor, actually, Dr. Oken in Florida, and I'll never forget, and I quote him often, he said, you know, Parkinson's disease is truly the most complicated neurodegenerative disease. I mean, there's 40 plus non-motor symptoms, there's 40 plus motor symptoms, and they're always changing. I mean, that's the difficulty. And so you have to have a provider that's willing to like stay up on the current knowledge, stay up on the current research. What new medications are on the market that are flooding the market right now? What can we possibly try? How can we make your lives as good as it can be just with living with Parkinson's? That should be the goal. And to constantly have that patient leave the appointment with hope and with some new tools in their toolbox of what they can do for themselves and what they can do in the context of their lives in terms of moving forward. You know, I love to actually even say to my patients is that, okay, and when I get that question, which all of us get a lot, like how much longer do I have and how much longer before I'm in a wheelchair? And I turned that conversation right around and I said, we are going to talk about now, from 4 months from now, what are you going to do better? What is going to be your goal that you're going to put in front of yourself that you're going to accomplish that you cannot do right now? And so I think it kind of boils down also to reality for sure, but it also is attitude of not letting Parkinson's overtake your life, of keeping control, whether that's keeping control of the clinician that you see, keeping control of your exercise, of what medications you take and don't take, what education you want to receive, You have a lot that you can control. And I think that's a really important thing that we all need to give our patients all the time, is hope and control over their disease.
Absolutely. And I think, and I do believe, kind of back to that conversation in the very beginning, if you don't get what you need from your physician, it is okay and actually a good idea to actually find somebody that you do get that from. Everybody has their own personality, and this is a long disease for, both the person with the disease and the care partner. So that relationship is just so important. Lauren, did you want to say something?
Yeah, I just think it's so important to have that hope and to have some tools in your toolbox so that there's something that you can do when you leave the doctor's office so that you can take action. So you know that you can exercise, that you can fight back. You're not just going to go home and sit in a rocking chair and stiffen up and die. You need to have some hope, and it's so important. And I think too many of us have left the doctor's office after our diagnosis without any tools or resources or knowing any guidance on where to go next.
It is so true. I just read something this morning that there literally are 145 either new medications or clinical trials that are in the pipeline right now. I mean, as of this morning, it's just, there's so much hope for the future. And that whole idea of, again, going back to finding a practice that meets your needs and keeps you informed and keeps you educated and helps keep you healthy, so that when there is a cure for this disease, and none of us know when that's going to be, but you're as healthy as you can be, mentally, physically, emotionally, in every respect. And so, that's how the fight goes on, and goes on with positivity and good attitude.
I had a question that was sent to me. I'm taking us in a different topic direction here, but the question was, now I have to go back up to it, sorry. The question was related to pain in the back, and pain in the back, constipation, can those things be related to the difficulty and breakdown between the communication between your brain and the gut? Can that be a cause for back pain and that kind of stuff?
I'll take this one if that's okay. So I am a huge advocate of understanding the brain gut axis and understanding what's happening in the neurotransmitters, and understanding what your gut's actually listening to, what your brain says, and your gut telling your brain, and back and forth. And so, yes, absolutely, you can have some back pain from, or even stomach aches from a severe constipation. But the idea is that we know now that there's something called gastroparesis. Gastroparesis is slowness of the gut wall with Parkinson's disease. And you can have this 5-10 years before you ever have the diagnosis of Parkinson's disease. And the understanding is, and again, some neurologists believe that this may be, 45, 50, maybe 60% of movement disorder specialists believe, and again, the numbers are going higher and higher based on research, is understanding what happened. What was the first thing that happened when somebody started having symptoms of Parkinson's disease? And one of the theories is that there actually is a prion disease. Bear with me. Prions are not viruses, they're not bacteria, they're proteins that can create an environment where your dopamine levels are less. Meaning that what happens is that there's a prion protein that misfolds and creates an opportunity for your gut to not work as well from signals and targets and all these other things that we'll learn as time goes by through biomarkers, and understanding that that prion may crawl up the vagal nerve, which again is a nerve that actually has a communication between your gut and your brain, and the brain actually starting to have some dopamine deficiency from those prion misfoldings. Again, this is, a thought process in regard to, you need to confirm it as time goes by, but there's some great evidence on this. So the idea, if this is happening, the brain gut axis is very, really, really, really true in Parkinson's, where you can have gut immotility, constipation, and difficulty in regard to the stretch receptors to a place where you can have severe pains, you can have constipation, you can have diarrhea, you can have all kinds of things that would create a difficult body for Parkinson's to actually walk forward in a good way. That said, even the metabolism of your gut wall and taking in what you're taking by mouth for medications or foods or water is not as perfect as it could be. So fine tuning that and understanding that and treating the constipation and allowing you to understand what type of nutrition you should be having with fiber and water, which I talk about all the time, is understanding that the gut brain has definitely a connection, because again, we're all whole. You can't take one thing away and say, let's just look at the brain and say, this is all the things we need to look at, because the brain is systemically taking care of the whole body. And so that's why we talk about head to toe understanding of how well you're doing. And so, yes, you can have back pain, you can have all kinds of things. Pain could be the first thing your first symptom that you have of Parkinson's. And I'll give you an example. A patient that had a rotator cuff tear. That was the reason that was going on. That was the reason why he was stiff on this side, having tremor on this side, and having difficulty with movements. And so multiple surgeries of this shoulder, and nothing got better. And it found out that ultimately why that happened is because the muscles were so tight and getting so strong that was pulling on this rotator cuff, creating this symptom. And ultimately, once the dopamine came in by mouth and somebody diagnosed them with Parkinson's, they did extremely well, and the pain got much, much, much better. So the idea of the body being a unit, whether it be gut, brain, or anything else, or pain syndromes, you really have to look at that. Again, it could be other things, but always address it and make sure that you're not missing something in regard to Parkinson's symptoms.
You know, thank you. Somebody also referenced, I forgot this, sorry about this. This was way earlier on. Somebody put a note in there that their anxiety has just been so high ever since the beginning of this COVID time. And it's really starting to significantly affect sleep for them too. Curious if you have any thoughts about some things they might do to both help with anxiety as well as with sleep.
So, oh, go ahead, Sherrie.
No, Salima, go ahead. I'll chime in.
Okay. So, certainly most everybody is more anxious during this time of COVID. It's really brought the young people to be anxious, middle-aged, older, everybody's sort of on pins and needles about this. And it also has affected people's sleep patterns, definitely. I think good sleep hygiene is really important. Exercise, again, absolutely important to decrease your anxiety, to make it so that you feel more tired at night to go to bed. Meditation is a really good thing to do in the morning when you wake up, and relaxation exercises at night prior to bedtime. Some people utilize melatonin to try to calm down and to sleep better at night. One could listen to some calming music, but also remembering too that anxiety can be part of an off symptom. So if that could be another thing that could be occurring prior to bedtime and leading into problems with sleep as well. So I don't know, Sherrie, if you wanted to add something to that as well.
No, I mean, I love that. I think that is one of the most frightening symptoms of Parkinson's, because anxiety promotes more anxiety, right? Mm-hmm. So you get anxious and you start thinking about your anxiety, which makes you more anxious. So that is certainly the time to change environments, get up, walk around, distract yourself with something else. Call your grandkids on the phone. We do something at Scripps, biofeedback therapy, which I of course do over Zoom, which there's no reason that you can't. And that's hugely helpful. Like Salima was saying, is stress reduction. But biofeedback therapy, if most of you are probably familiar with it, but it literally is a way to focus on your breathing and to breathe in oxygen and release anxiety, and do that through the power of breath. And it is powerful. It is really powerful to do that. So I think for anxiety, also, I did want to add, as far as the sleep, is that we know anxiety can get so much worse with bad sleep. So one of the hugest emphasis of every clinic appointment I have with patients is we talk about their sleep, because you have to get a good night's sleep. I mean, so many times people are taking that little snooze that happens, when they're watching the TV or reading a book, turns into from a 15-minute snooze into like a half hour, then it's an hour, then it's an hour and a half. Then that sets up the whole problem with sleeping at night, right? Because we only need X number of hours of sleep given in a 24-hour period. So I think it's really important to get a good night's sleep. Please, melatonin. I actually am a big proponent of CBD. It works really well with our patients for sleep. But that emphasis, really focus on that emphasis with sleep. Also, sometimes a long-acting carbidopa levodopa, Rytari, when you go to bed, is really helpful to help relax your muscles, because those muscles get dopamine depleted at night. And that dopamine depletion can make your body stiff, and it's difficult to roll over from side to side or possibly get out of the bed, which most of you have to do multiple times a night to use the bathroom. So sometimes a little Rytari right when you go to sleep is just, it can last when you're sleeping maybe 4 hours or so, possibly longer. And again, I mean, none of us can mention this enough, but exercise during the day, and preferably outside where you're getting some good oxygen, and really, flushing out those, the kind of the bad stuff out of your body with exercise, and bringing in that fresh air and that oxygen is really important. And it does help a lot with anxiety, and it helps a lot with sleep.
I'm
Can I
hearing.
chime in? Sorry, can I chime in real quick? So there's can we go into a little bit about the 5 stages? Oops, sorry. Oops, I'm here. Hello. Can you hear me? Hi, sorry about that. So I always talk about the sleep hygiene tools, just because it's so important, especially because a lot of people feel like fatigue is part of the disease, which it can be, but I always talk about sleep hygiene as important. And so I talk about the 5 things. One, you're making your space a sanctuary, making it so the only thing that you do in that there is sleep. Ultimately looking at is there a lot of things that are giving you a little bit of distraction, whether it be big lights and watching TV in bed and things like that, because you have to find a way to actually have that place be your sanctuary so you actually can fall peacefully to sleep. We also talk about how much water you're drinking before you go to bed, because we do have a lot of times you get up to go urinate, and we'll talk a little bit more about that in the future of why that happens. But the idea is, if I usually say 6:30 or 6 o'clock is their last big gulps of sleep of drinks, and then again, I know water is important, so we have to talk about that as well. But you want to be able to do the sips at night so your bladder is not so full. So you also want to make sure your bladder is completely emptied before you go to sleep, right before you go to sleep. I also talk about not having electronics that are available to you all the time to see what time is it. Oh, okay, it's 2 o'clock in the morning. I have more hours. That's math. Guess what's that? It's math. That wakes you up. And so it's better just to keep it away and find your way to actually find either you're counting sheep or whatever you need to do to actually help yourself. It really, really, really helps. And so those things, I also talk about rumination. You don't want to have a huge meal when you go to sleep, because ultimately that can wake you up, create a lot more dreams and things like that. So I usually say switch it. Have a nice, happy, big meal in the breakfast time and lunch, and then a small meal at the end of the day if you can. That helps as well.
Those were a lot of tips. And by the way, this has been so amazing. I just so enjoyed reading the comments that sometimes I forget that I have to actually, facilitate. But the comments have been amazing. And what's a wonderful thing is that this is going to be recorded. It'll be on our YouTube channel, so you can watch it over and over and get all sorts of goodies from it. The other piece is there's been a lot of little ideas and thoughts from each of you, and I think that is really super helpful. One thing that somebody brought up, and I think it was Elaine, she wrote, I gotta find it, hang on a second, it was a little bit ago. Elaine wrote about how these three ladies are so knowledgeable and personal. I bet you have a very long waiting list. Sometimes it's hard to change doctors when there's multiple year waiting list. And a couple people have mentioned the waiting lists and that you have to wait a really long time to see a doctor, or where they live, there's no doctors, or maybe one doctor for an entire community. And, I think that I love being able to have movement disorder specialists like you guys. I love being able to have this expertise because it really shows people the difference between, and I'm not discounting general neurology. It's a wonderful thing, but it's also general, and there's tons of diseases they're covering, and you guys focus in on movement disorders. It's a very different experience, the level of understanding. Do you have any thoughts about how people can navigate this? And also like telemedicine, the use of telemedicine that we now have.
So, yeah, I think the world of telemedicine is a beautiful thing. It really is. I think it's a way to really being able to reach out. It will never be the same as like we've all talked about, the hugs and the touching of someone's knee and that face-to-face reassurance. But, the longer I think that we're doing this telemedicine form of delivering advice and support and education to our patients, it's like anything, the more we do it, the more comfortable we are, and the better we get as clinicians, honestly, of doing a motor exam over video. I mean, I've gotten pretty good at that, really being able to pick up on rigidity, bradykinesia, gait issues. Do I need to refer people to their physical therapist, occupational? I can hear them. I can tell if they need speech therapy, which, by the way, I have to put in the plug for that as well. Another little tip. All of you, if you're Medicare, those who aren't Medicare, disregard this little tip, but you have $1,900 a year for services, physical therapy, occupational therapy, and speech therapy. This is not therapy that you do once in your Parkinson's lifetime.
No.
Take advantage of it every single year.
Yes.
Consider it a paid trainer that understands your body, your individual body, and your individual needs. Not like and don't get me wrong, I love Zoom exercise classes, but the important thing is zoning in on what are your needs, because Parkinson's is so different. And they're doing speech therapy on Zoom. We're doing physical therapy on Zoom, occupational therapy, a little bit more difficult certainly to do on telemedicine. But I think telemedicine is here to stay. And I think I share the opinions of my two colleagues that it's here to stay, and it's going to change the world of access to movement disorder specialists.
Yes, definitely. I agree with you. I think we're getting better. And I personally was doing it prior to COVID, and I continue to do it just as my colleagues do, and plan on to continue doing it more and more as time passes. So yeah, definitely.
And the beauty of it is that I think that there's a lot of places in the United States that there is not as much access as we wish that you had. And so
Right.
The goal going forward, I think, is that we're going to make sure, and again, I can see a lot of changes in the medical field to be able to take care of people outside. Again, we're all in California right now, but that's going to change. So I want as much reach as I possibly can in this world to be able to make sure I can educate as many people in this world. There's no question in my mind. That's why I was born on this earth, is to be able to educate and learn and teach as much as I can across all boundaries. And so the goal is actually in time to make sure that that's available to you.
Yep, absolutely.
And I just think, keep an eye out, because we will keep you posted about what's happening from a legislative and reimbursement perspective, because that matters a lot in terms of being able to provide these services. If insurance companies won't cover them, then, or if people can't afford them, then that's a problem. So we have to figure out how to make these things affordable and how to make these things able to cross state lines, because there are many, many places where there is an absence of providers. And there is no reason with telemedicine that we cannot provide services to every single human in this country, right?
Absolutely.
Yeah, so keep an eye out on that. We will let you know when there's opportunities for legislative action.
Idea for a topic that you might have addressed.
Yeah, go
Hear me
ahead,
okay?
Peter.
Well, something you might have addressed, or should have brought it up earlier, but I don't know my list, is why your medications aren't working. Why somebody's medications aren't working properly. That's a big deal.
Oh,
Why
what?
somebody's medication is not working properly?
Right, yeah. Yeah, so one of the questions is it old wives' tale or the truth about proteins in the gut? What when you take your medication, you know what proteins in your gut?
Mindy, you want to take this one since
I'll
you
take
love the
this.
gut? Go ahead.
Love that. Okay, so we know for a fact, at least for the carbidopa, levodopa, Rytary, Stalevo, Cinemet, that where the medication is absorbed is in a place called the duodenum, which is in the small intestine. And where those proteins, those fats, those carbohydrates, those amazing corn on the cob that you're eating is ultimately being absorbed and is in the duodenum. So imagine this, your duodenum's full of food, right? And then you take your medication at the same time. Who's gonna win? Your food or the medication? Naturally, the food will be absorbed first, and guess what happens to the medication? It becomes very expensive stool. I know that sounds funny, but you gotta think about it as your proteins and your fats hang out in your gut much longer. It just takes longer for them to metabolize. And so proteins and some fats can be hanging out there a long period of time, and you're not getting the benefit of that medication just simply because your body has only one mechanism. It's to metabolize what's ever in front of it. And so guess what's going on the backside? Your medication, and it's not going to work as well, or you're going to get less improvement, or ultimately all hangs out in the gut for a while, and it all gets released at the same time, which can cause the dyskinesias. And so you have to look at you individually of why your medications are not working well. That's why you need to talk to your doctor and talk about details of what your body's doing and what you're doing and what you're putting in at the same time. Are you drinking water? Are you constipated? And all those things have to be an individual approach to you of why your medication's not working. Okay.
Such a great, thank you for that. And what a great explanation. Such a good question too. And I know I'm with you, David, a thumbs up on that one. So that, and I know we're getting pretty close to time here. So I know I have to watch that because these lovely, amazing experts have to get back to seeing their patients. But I do want to tell you that, you know, if you are trying to locate or connect with a new provider, if you're not feeling a good connection, if you have questions about where providers are, please feel free to reach out to us. We will help connect you. We're always here for that for you. This has been an amazing conversation. And we will have another conversation with these terrific experts on December 8th at the same time. So it's about 6 weeks from now or so. And so keep your eyes out for that. We will definitely look forward to the next conversation, which will have a different topic, but of course, we're always open to any questions and discussion you have. Tomorrow we will follow up and kind of do a little more deep dive. We'll be looking at a new medication that probably many of you have never heard of, a brand new medication. And it actually operates in a different system and a different dopamine receptor in the body. And there's some conversation about that too, about how medication is processed. So you can join that tomorrow. And then Thursday, we're going to have kind of take it to the next level down in terms of how do you start to quantify what that different cognition, the changes in cognition, how do you quantify that? So when you're talking to your doctor, you can help them understand what that's really looking like for you. So we've got some great programs coming up. So make sure to keep an eye on those. And I wondered if the three of you want to say any final words, because it is just wonderful to hear from you. I could do this all day.
Well, I just jump in real quick. And I just would like to remind all of you that are listening, first of all, thank you for tuning into our first Hear Me discussion. And I cannot emphasize enough, the reason we're doing this is for you guys completely. So We are here 100% for you. We are here to answer your questions. I really encourage you guys, if there's a certain topic that you've kind of been wondering about or been tough to talk to your own provider about, and you think it would be kind of a cool thing to discuss with all of us here on this Zoom call, please reach out to Sarah Jones and to the PMD Alliance folks that have been amazing in all their presentations and support and online exercise classes, etc. But I just, again, thank you for coming, and we're excited to be here. We're excited to educate and let you know what we know, and hopefully give you a few tools to work on between now and our next Hear Me series. Thanks, you guys.
Thank you so much for the great questions and for being here with us. And like Sherrie said, just anything that you guys want to talk about, we'd be happy to answer. We are all three so passionate about educating and supporting not just the person with Parkinson's, the caretaker, the adult children. We know how hard this is for everybody involved, and we feel it. We feel all of your pain, and we want to make this better for everyone. So I hope that you'll be able to find us a comfort and a source for you. So thank you.
I absolutely agree. We decided on this, hear me. So we're hearing you. That's what we want to do. So the whole idea is that everybody has a voice, and we're excited to hear yours. And thank you so much for letting us be a part of your lives today. And we look forward to seeing you on December 8th.
Great.
Have a great day.
Well, everybody give a little wave of gratitude to Sherrie, Salima, and Mindy for joining us and sharing their expertise and your passion with us. It was wonderful to be with you all. If you can't find the links, I've had a couple questions for the programs this week. Send us an email at info@pmdalliance.org, and we'll make sure to get those to you so you can register. But thank you so much, all three of you, for taking the time with us today.
Thanks, Sarah. Thank you.
So much.
Take care. Our pleasure. Bye.
Bye-bye.